I'm Jerry Brown of Sativacom. I'm here with Roger Martin, who is the founder and executive director of Grow for Vets. So Roger, let's start just by tell me a little bit about what Grow for Vets does.
We give free cannabis to veterans for treatment of serious medical conditions like PTSD, chronic pain, a wide variety of other ailments, injuries, and illnesses. The drug of choice that I was given when it first came out, actually, or about a year after it first came out, was OxyContin. And by October of 2010, I was taking 180 milligrams of that a day. And I was taking 20 to 30 milligrams of Ambien to get 1 to 2 hours of sleep at night. Fortunately, I met a really good doctor who suggested I try cannabis. Having a former law enforcement background in another life, I wasn't excited about doing that because I kind of bought into the thought that it was a dangerous drug and led to more, serious drug usage and so on and so forth. I just purchased a German Shepherd pup, and I was at a training facility. I ran into a lot of young veterans who were training their dogs there to be service dogs, and I found that a lot of them had PTSD, a lot of them had other chronic pain issues. They told me some of them were taking 15, 20 or more prescription meds every single day. They also told me that cannabis was the only thing that had ever helped them with their PTSD, and that it was very expensive to buy. So a couple days after I heard these stories, I guess for maybe 3-4 weeks, so one night in the middle of the night I woke up about 4 o'clock in the morning. It just occurred to me that I should give free cannabis to veterans, and I was fortunate at that point in my life not to need an income. And so I was able to devote my time to doing that. People donate the cannabis to us that we give out. We also give out a lot of cannabis-infused products. Mm-hmm. We've had some incredibly generous donors.
In the 14 years since 9/11,
right,
we have lost about 6,850 military personnel in combat in Iraq and Afghanistan.
Right. We lose more than that a year.
Right, and according to the VA,
mm-hmm.
Study they put out, they estimated about 22 a day or
right.
8,000 a year, so more suicides per year
right.
than we've lost in combat over 14 years.
Right. Right.
I know you believe, and I think a lot of other people believe, that number is actually understates the problem by a lot. Explain why that is.
The reason I think it's a higher number is because a study that the number 22 comes from was conducted in 2012 by the VA themselves. They only included 21 states in that study. Of the 21 states they included, 23% of the deaths they had no cause of death listed whatsoever, and they left out some small states like New York, Texas, and California. I've had thousands of people now, Jerry, thousands of veterans tell me that cannabis is the only thing that's ever helped them with their PTSD. Not one drug the VA gives them has ever helped at all. The American heroes that I'm honored to serve every single day deserve better than having their first treatment option, and usually their only treatment option that's free, being deadly prescription drugs. They deserve something better. Cannabis is a safe alternative because it can't kill you. So it's, again, another one of those things that makes no sense to me whatsoever, why it would not be a doctor's first choice in treating a veteran. They can give them the cannabis, prescribe the cannabis. If that doesn't work, they can always resort to the drugs that may kill them.